Welcome to today's program, and thank you for joining us. I'm C. Virginia Fields, former Manhattan Borough President and currently President CEO of Black Health, formerly known as the National Black Leadership Commission on AIDS. And in 2019, after a 3-year branding process and over 32 years of service to the Black African American community, we underwent a major change, organizational change, and the name became Black Health, with a new mission that is to champion the promotion of health and prevention of diseases to reduce disparities and achieve equity within the Black community. And our vision for achieving this is through advocacy, policy, and education. And this was a major development and organizational change because we expanded our health focus areas from just HIV/AIDS, but to include broader health focus areas that disproportionately impact Black African Americans. So continuing with HIV, hepatitis C, adding cardiovascular disease, diabetes, mental health, breast cancer, sickle cell, and prostate cancer. Based on the data, those are the health focus areas that continue to disproportionately impact Black African Americans. And today, we are very pleased to discuss one of our topics, and during this time of mental health awareness and focus on mental health issues, we will discuss the importance of destigmatizing mental health in the Black community. And I'm so pleased to be joined by Dr. Henry Willis, who is clinical psychologist and researcher. And his research interests focus on areas such as exploring the relationship between online and offline racial discrimination and mental health outcomes, understanding sociocultural protective factors such as racial identity and how they impact psychopathology within African Americans, and creating cultural adaptations of evidence-based treatments and utilizing mobile health technology to increase access to mental health treatments for underserved population. Just by way of some more background, Dr. Willis is a native of Jackson, Mississippi. We have that in common, Dr. Willis. I'm a native of Birmingham, Alabama. So the association there is the South. So he's a native of Jackson, Mississippi, and he currently serves as the faculty at the University of Maryland College Park, and assists in clinical training at the Hope Center, which is a mental health clinic here in Harlem that provides services free. So welcome, Dr. Willis. I am delighted to talk with you, and reading your bio, that was most impressive. So let's start just by you saying, helping our viewers know a little about what led you to the field of mental health.
Yeah, that's a very great question. And thank you for inviting me to be on. And I'm really excited to be here. And thank you for all the work that you and your organization does around Black health. It's very much needed. And I'm so just pleased to see all the great things that you all are doing. But I really got interested in mental health during my undergraduate career. So I went to Howard University in Washington, D.C. And there I really got to learn a lot about not only psychology, but just how psychology can be used to help us better understand a lot of the mental health and even social issues that that the Black communities are facing. And so later on, as I was pursuing my master's, I was actually an intern at the New York State Psychiatric Institute in Washington Heights. And I noticed that in our research lab, we were offering free mental health services as long as people were a part of research. But I noticed that there were no Black Americans in our studies or even Latinx American in our studies. And as you all probably know, with us being situated in Washington Heights and just, a stone's throw away from Harlem, this really highlighted just those inequities and just kind of access and even education around mental health and mental health treatments. And so that's what really motivated me to pursue my PhD in clinical psychology, and really the sole focus for why my research revolves around really exploring how to address these health disparities for Black communities.
Well, you were certainly working in an area in terms of the community here in New York City where the needs are great, and quite often we don't always seek the care and the help that we need. And based on some of the data and the reports, it states that Black adults are 20% more likely to report persistent symptoms of emotional distress than white adults. So, based on your experience and research, what are some of the most prominent causes of emotional distress among members in the Black African American community?
Yeah, really great question. I think is there's so many different factors that contribute to it. I think, one, we have kind of those broader factors that are really affecting a lot of different adults. So we still have spillover effects from the COVID-19 pandemic in terms of just the impact of isolation, but also just a lot of loss, for whether it's grief and loss for loved ones or non-death related losses. So people losing, their jobs, or just losing other economic opportunities, or just plainly losing time, and just kind of feeling this sense of loss and being held back is one factor that's contributing to this emotional distress. And on top of that, we also have to look at those culturally specific kind of experiences that Black people go through that contribute to their distress, such as experiences of racism. So, actually, in a recent study, it was found that Black youth, for example, experience 5 racist incidents a day. So that's a very high number. And these data also show that these instances are related to worse mental health outcomes. And so again, we still kind of have those spillover effects from COVID. We have experiences of racism and discrimination that are associated with worse mental health. And then on top of that, we have a lack of access to culturally relevant providers, and a lack of access to services in general in community spaces. And all of that creates that perfect storm for kind of what we're seeing.
Yeah, and you touched upon certainly some key factors, including racism. And we
Mhm.
know that institutional racism continues to play a big part that has denied this population access to services. And even when there are resources available and this population access them, they're still not treated the same way with the same care and the ability to move forward in a way that has really, we've seen, make a difference in other communities. You also touched upon something we hear a lot about too now, and that is the isolation that COVID imposed upon all of us. And, people living in fear and the trauma that created, even though many of them perhaps never uh, uh, contracted COVID itself, but being isolated and being fearful. And here in New York City, where so many people live in apartments, some are studios with no space to move around, or no uh, communication with people, that is still something that I'm not seeing, and perhaps in your work and your experiences, that we're focusing enough on that after COVID, not the long term impact because a person, actually had COVID and still trying to deal with that physically, psychologically, and mentally. But just the issues you talked about, the isolation, the loss of communication and people they knew. Because
Mhm.
quite frankly, I was saying the other day, now I'm a member of Abyssinia Baptist Church, and I was saying to some friends the other day, sometimes I look around the church and I remember where certain people, would sat. And I heard about some of them passing during COVID because of the announcements. And others, I don't know if it was because of COVID, but they're no longer there. So we experience this in many different ways. So, what are you seeing in terms of the impact of long term COVID unrelated to actually having the disease itself?
That's a really, really great question. And you're right. I think, we are still kind of focusing on kind of, maybe those longer term impacts of COVID, but not really dealing with a lot of the devastation that people in Black communities in particular are still experiencing. So, actually, in my own research, I spent about 2 years while I was at Columbia University working with community stakeholders, particularly pastors and other community leaders in Harlem, to explore specifically how COVID-19 just impacted their mental health and experience of loss and grief, but also how we could better deliver services to just really support the Harlem community. And I was actually, our community partners were mobilizing preachers and communities in New York, led by Dr. Johnny Green, who's at Mount Nebo. And one of his stories that really still sticks out to me is that he lost, I think, around a dozen parishioners within a few days or a few weeks of each other, which was one of the highest kind of losses in, for a church community at that time in the early days of COVID. And so we still have people kind of still reliving that trauma of seeing those refrigerator trucks, in the community. Or, again, like you said, kind of looking around and not seeing the people that used to be there every Sunday, etc. And because of that lack of communication, some cases people knew, when people passed, but other cases maybe not. And then that anger on top of it, because we know that there were inequities in healthcare that made it even more likely for Black people, especially in Harlem and in New York and other marginalized communities, to not get the healthcare they need, not get the vaccine and the education that they need, or the mental health resources to cope with all of those things that were happening at that time.
Also, we're seeing a lot of reports about Black youth ages 10 to 19 having experienced the largest increase in suicide rates, totaling 78%. So, considering the rise in suicide deaths in Black community, how can we approach conversations about mental health in our homes, in our schools, in our faith based institutions, and in the community in general, especially among with our young people?
Yeah, I'm really glad you brought up the youth aspect. So even when we were working in Harlem, one of the things our community leaders often said was that, the youth need to be in these kind of research activities, or we really need to find ways to help the youth because they're really struggling. And we were actually able to incorporate Black youth in Harlem in our research, and we've seen things like, they've experienced a lot of loss, whether it's through community losses or community violence on top of COVID-19 losses, the experience of gentrification and kind of feeling displaced in their own communities, and even just a sense of numbness as a result of all of these different, inequities that they have to navigate. And so I think in terms of having these conversations, well, we have to not be afraid to have these conversations, and know that you don't have to have a right answer or the right way to navigate these conversations. It's just important to bring it up because actually, in my own work, when I've worked with youth and young adults, they often felt that those, their parents, their aunts, people from older generations kind of did not either talk about mental health or they had a resistance to talking about mental health, which made you feel even more isolated. So again, I say just having those conversations in our churches, in our homes, in our schools, that's going to be the very first step in kind of, really kind of helping our youth, but also, really thinking about creative ways to reach our youth. And so my research also looks at how can we develop or use technology to increase access to mental health services, particularly for Black Americans. And I actually just received a grant from the Robert Wood Johnson Foundation to work with Black youth to create a mental health app that they can use to cope with their own kind of mental health distress. And so I think, those are a couple examples of things that, myself and other Black scholars are really trying to think about and think about ways to reach our youth, especially with the rise in suicide rates.
You want to talk a little bit more about that mental health app and how people can access it? Because I think that that is something, because, the young people on social media, and we know that that is basically how most of the information that they receive comes. So to have an app that addresses this, so can you say a little more about that, please?
Yeah, 1,000,000%. And you're definitely right. We know that youth and just people in general, especially since COVID, once we just were online more and isolated more, people are seeking these mental health answers and support in online spaces and digital spaces. And that's, is both a double-edged sword in the sense that sometimes it can increase access to really good information and education and resources, but also, the internet is a very big and vast place, and not all information is what we call, reliable or evidence-based. And so what I really enjoy about this app that we're making is that we're actually going to center youth in the development of this technology, because we also know that most apps and, a lot of these technologies aren't built alongside Black communities. They're kind of built and then delivered to us versus, again, incorporating us in the design of that. And so what we're going to be doing is, working with youth to design this app. We're going to bring our expertise in clinical psychology to give them the resources, and then they're going to help us design and then eventually promote and distribute this app. So we're in the very early stages of development. We're actually starting to recruit our team of Black teenagers to help us and to find out more information and to potentially be a part of this work. You can reach out to my research lab, which is willislab@umd.edu.
Okay, no, that's very exciting. And I think, that's an important way that we should be engaging our young people, because as we often say, if the people who are most impacted or affected are not at the table helping to have these discussions and develop solutions and come up with interventions, we often miss the mark by trying to do it for them in that particular way. You talked, I think, when I mentioned about the work in the areas in which you are very much exploring in terms of your research, creating cultural adaptations of evidence-based treatment. How does one best go about trying to find a service or resource that is more culturally relevant and acceptable for that population? What are some of the things that is happening in that area?
Yeah, really good question. And when we say culturally adapted, it's really, thinking about, not just how we think about how we deliver services or who are delivering these services, but really, can these treatments take into account those things that are important to Black communities, whether it's, feelings of resilience and collectivism and really just strengthening the community? How can we bring that into the therapy room? And also, how can we teach providers and create interventions that target those things that are specifically stressful to Black Americans, such as experiences of racism? And so a lot of the work that I'm doing and others are doing are thinking about, how can we help Black youth and young adults kind of cope with racial trauma, for instance, or how can we really kind of strengthen one's kind of feelings of racial identity and kind of pride in being a Black American. And in terms of finding these services, I'm definitely first starting within a community. I think the Hope Center, which stands for Healing on Purpose and Evolving in New York, specifically in Harlem, is a perfect example of that kind of community-based mental health resource that's also culturally adapted. And so it is a part of First Corinthian Baptist Church. And so it's kind of marrying both the mental health and religion and community aspect. And it's also dismantling some of the barriers that people face when seeking services. So all of the services that are provided by the center are free of charge. And so in these services, again, we really try to rely on cultural practices and things that really not only make us feel, proud about our communities and our culture, but also incorporate these kind of evidence-based interventions to help people who otherwise may not have thought to or may not have had the means to seek mental health services start to, get the help and support that they need.
So what's the outreach in terms of persons who might want to come to the Hope Center and may not be a member of First Corinthian? How do they know about it? Is there a recruitment or an outreach program process that helps people to know and to be able to receive the free service, which is really great? First Corinthian, I know, has done a great job in that area. I do know something about their work there. So what's the process? How does one, say, get connected?
Yeah, definitely. So you could go to the website, hopecenterharlem.org, and you don't have to be a member of the church to receive services. It is open to anyone in the community, and you don't have to live specifically in Harlem. So we do service people in other boroughs in New York, and we provide both in-person and telehealth services. And so the outreach has definitely looked like, definitely starting locally in the community through not only just, church activities, but also community-wide activities. I know the Hope Center, we've been in the Harlem Parade every year. We try to do a lot of different outreach, also at local universities, so to really try to get our Black young adults involved. We actually train and bring in students, so master's level students who are training to deliver culturally competent care. So we also serve as a training ground, which is another kind of way we're engaging in that outreach of promoting these mental health services that are culturally competent and accessible.
Great. Now, in the last 3 or 4 minutes that we have, I want to flip and ask a little about policy, since, of course, that's a major issue, area of our work in terms of achieving our mission. And that with the proposed legislation, such as the Pursuing Equity in Mental Health Act being introduced at the federal level, what role does policy play in ensuring that all community members have access to mental health services, resources, especially members and communities of greatest need?
Yeah, really great question. Policy plays an enormous role in really helping us solve those inequities that we see in mental health care access. So one things in terms of really changing our policies around insurance reimbursement. So there are a lot of therapists that are forced to be out of network because of just very bad policies around insurance reimbursement and just equitable pay, especially for those therapists that come from marginalized background. So we really need policies to improve just how insurance companies are, how they are reimbursing and really covering for mental health services. And also we need funding for mental health training. And so as we have a lack of people of color and Black individuals as therapists, not because of a lack of desire, but because of the immense barriers that they face in the training process, whether it's getting into graduate school or affording graduate school, or being able to feel safe and welcome in these different spaces. And so we do need policies to really help us increase the outreach and retention of therapists of color. And then finally, we need policies that can help us really kind of create a more national service for mental health. And so now we have a lot of policies that restrict people from therapists from seeing patients in other states, etc. Some of that was alleviated during COVID, which is why we saw that big rise in access to mental health care. Because if somebody wasn't available in your city or in your state, you now could go to someone in Mississippi, for example, if they had an opening, and do a telehealth session. And so we do need policies to help us think about how can we dismantle these barriers that people face when seeking mental health care.
And I really do only have one more question, but there's one I do want to ask you, because we see it so much in our community now, where family members and community members will call if their loved one is experiencing a mental health episode. So what advice would you give the family members where a loved one might be experiencing an episode and they want to get help for them, and they don't want the situation to get out of control, which we have seen unfortunately too many times? So in 1 minute.
Yes, I'll try my best. But one, I would say to give themselves grace, because again, it's hard to know the right thing to do. And like you said, when calling 911 in these emergency situations, unfortunately, can often make the situation worse, especially for Black Americans and Black communities. And I think the first thing to think about in a crisis is how to provide support and space. And so one thing that I often tell people is that people in severe crisis feel like they're in the bottom of the well, and people are just kind of throwing down, suggestions or throwing down things, versus, at that moment, they need someone to maybe just sit there at the bottom and listen to them. So providing that space and not, feeling as if you have to solve the problem can be one of the first steps in resolving a mental health crisis.
I tell you, Dr. Lewis, you have covered such a wealth of information and sharing, and I know that it is very helpful to our viewers, and I simply want to thank you again. And I'm certain that leaning on your experience to destigmatize and improve mental health within our community has been beneficial to our viewers. And as we continue to strive for health equity through advocacy, policy, and education, may we remember that if we want to go far, we have to go together. And you've certainly laid a pathway for us being able to go together. And I'm sure that you're going to be getting some responses from our viewers when they get to see this. So for more information about Black health, please visit our web at www.ndlch.org and look for us on Facebook, X, the former Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to better inform you, our viewers, about the important topics that impact your health and well-being. So please let your family, your friends, your neighbors know about the programming. And I am C. Virginia Fields. Thank you for joining us, and hope you will tune in next time for Health Action TV on Manhattan Neighborhood Network. And thanks to Dr. Willis for such an informative discussion today. Thank you.
Thank you for having me.